And so I think we're going to go ahead and get started. Thank you, everybody, so much for being here tonight. My name is Russ Ellick. I'm the communication specialist at Burlington School District. And we are joined here this evening by Superintendent Flanagan, our district lead nurse, Becca McCrae. Give us a wave, Becca. And we're joined by two pediatricians, Dr. Rebecca Bell and Dr. Stanley Weinberger. We're really grateful for your participation. Dr. Bell is a pediatric critical care physician at UVM Children's Hospital. She's also an associate professor of pediatrics at the Larner College of Medicine at UVM, and she's the president of the Vermont chapter of American Academy of Pediatrics. And when we said local in the email, we weren't lying. She's also a Champlain parent, so she's had firsthand experience in the doctor's office setting and with our schools. The same is for Stanley, Dr. Weinberger. Dr. Weinberger has two children, also at Champlain Elementary. He is the primary care physician and the division chief of primary care pediatrics at UVM Children's Hospital, with an area of expertise in refugee and immigrant medicine. He is the parent of, as I said, of two kids at Champlain Elementary. So before we get started, a couple of housekeeping items I just want to let everybody know. One is this message that we've been really trying hard the last few years to be more equitable in our communication and our resources. So we're just going to be honest as well and transparent. Like, this message is not being translated this evening. This message is being delivered in English, and we are working with our multilingual liaisons to get this message out to our families afterwards. It is being recorded and it will be accessed on YouTube, and we'll be meeting with liaisons in the next few days as well. So that we can make sure that all of our families have access to this and have the ability to have their questions answered. The second big piece is I just want to remind everyone that we have a vaccine clinic tomorrow at CP Smith. Last I checked, we have about 100 slots open. So if you've been on the fence about getting a booster, please come get it. If your child needs a first dose, please come get your first dose. We want you there. If your child needs a second dose, we want you there. It's at CP Smith. It's from 9 to 3. You do have to be present so that you can sign the waivers. But we will be there, and I will drop the I'll drop the link to that vaccine sign up in the Q&A at some point this evening. And you know that we have Dr. Bell and Dr. Weinberger here. So right now I'm going to turn it over to Superintendent Flanagan to take it away.
Great, thank you, Russ. Appreciate the welcome, and Dr. Weinberger and Dr. Bell, thank you so much for being here. And also Ms. McCrae, Becca McCrae is here. Thank you, Becca, for everything you've done. Becca has kept us in a place where we are safe, where we know what we're doing and how to pivot and how to make changes on the dime, and has been putting in just incredible amounts of time and effort and heart into this job. And just want to thank you, Becca, for that. Want to thank everybody on the call today. I feel so grateful to be a parent in our district and a superintendent, and also hopeful about where we are going to be headed. I'm really thankful for the partnership that our community has shown, that you all have shown throughout this time. We've been in 2 years of real major challenge, and I've been just so impressed by the way the community has rallied together, how we all have worked together for our students. And I see that in every possible direction that I look. So thank you to the community, to everybody for I know it takes us all to make this happen. I had a chance to visit schools today. I was delivering tests this morning to IAA. Our testing supply has been extremely stretched to the point where today and tomorrow, I was questioning whether or not we could open school based on the number of tests that we had. Thankfully, we got a huge number of tests today that the National Guard delivered. The Agency of Education answered our calls and sent a number of tests our way. And we also have ordered 5,000 tests ourselves, and those came in today. So we're in a much better place with testing, and we're able to sort of take a breath and not worry about where the tests are coming from to operate in the morning, but to now think a little bit more about how we are pivoting now that Omicron is the variant that we're dealing with and is causing us to think differently about the way we operate. but I was delivering tests at IAA this morning, and then went to a visit at Hunt Middle School. And I just was so taken by, despite the stress that educators are under, which is really incredible right now, just the love that they show and the love and care that they're showing for students. You just see it in every interaction. I see it in every interaction. And it's just such an important part of our district that I want to share with you, because I know many of you who are parents don't get to see that and have been missing that for the past 2 years, where we haven't really been able to take many visitors into the building. But there's a lot of care, a lot of love, a lot of joy in our buildings, even today when we're under great stress. And just a huge shout out to our educators. Our educators are, I can't imagine a better group of teachers and school leaders and nurses and paraeducators and mental health professionals in our buildings, working so hard right now. I want to really shout you out and thank you. And I understand it is incredibly hard right now for our entire community. And we really want to help with that. So tonight is about providing information. I think some of this incredible stress that we're under right now is a result of changing dynamics and fear and anxiety, and those are very real things. I feel them personally with my own kids and for the kids of Burlington schools. And so I know that is a very real thing. And for me, it's helpful to have more information. The more information we have, the more we can put things into context. And so tonight is really about providing that information and having an opportunity after Dr. Bell and Dr. Weinberger give us a little bit of information to take some questions that you all have posed to us. I also want to just note, and we can put some more information out about this, but the Chittenden County superintendents are also organizing a webinar that'll be more specific for educators. So we may, so there'll be another webinar for educators, and it looks like that's going to be next Monday night. That will be taped as well, and people can look at that outside of that time. So I talked about the tests. We are, as you all know, we've received new guidance 2 weeks ago that reduces the quarantine window from 10 to 5 days. We also have heard that last Friday that we will receive additional new guidance that will be a significant policy change that will come out of the Agency of Education. We have not received that policy change yet, but we are anticipating that we will tomorrow. So ideally, we were thinking this meeting would be timed so that we could give you some more information about that guidance, but we're not able to do that yet. So we'll continue to message that out in every way possible. But we do expect new guidance to come out tomorrow, and we expect that we will be required to implement on that new guidance beginning next week. As a part of the work that we are doing now, our prioritization of efforts to keep our community safe continue to be around masks. We have ordered KN95 masks, additional masks, both for staff and students, and are going to be able to distribute those. We're also currently distributing masks to students at the door. Today at IAA, we were just handing out masks like Skittles on the way into school. So that we are offering masks out, and we'll continue to do that. And masking is an important part of our strategy. In addition, vaccinations. It's so important that we are getting vaccinated. We still have a number of families that are not getting vaccinated. And I think it's just really important that we share as much information about that across our community, because that's just going to be a really critical strategy to keeping ourselves safe as a broader community and individually. And testing, we are still doing testing. We were doing tests. We were testing this morning. We'll be testing tomorrow. We've tested every day this week. We'll be testing next week. We'll tell you more about what that will look like when we get the updated guidance, but that will continue to be a strategy for us moving forward. And as we are thinking about and planning and implementing our plans around new guidance, we understand that systemic racism is real, and it impacts public health. It impacts the health of our communities, particularly our communities of color, our communities that our society has traditionally and historically marginalized. And we're going to be paying close attention to that as we make decisions about how we implement. any new guidance that comes out. So that's something that we are very mindful of. And I also know, and we've heard a lot from multi-generational families who are concerned about grandparents at home or younger children at home. That's something that we are going to be planning for and thinking about and learning more about how to make sure that we are doing everything we can to keep ourselves safe. Lastly, we're open to feedback. Please, we're going to answer questions tonight and try to get through as many as we can, but we also want you to reach out if you have additional questions. We are open to feedback, even hard feedback that I get. Russ will tell you, I ask my team, take each of those points and let's figure out what in there we need to look at to change the way we're operating. So we're open to your feedback. Please know that and thank you for giving us your feedback. So with that, I will pass it over to Dr. Bell, who's going to give us an intro and some information. Thank you, Dr. Bell.
Sure. Yeah, thanks. So I work here in the Pediatric Intensive Care Unit at the Children's Hospital, and I also currently am the president of the Vermont chapter of the American Academy of Pediatrics. And some of you may or may not know that Becca McCrae, who is the wonderful BSD COVID coordinator, is also the president of the Vermont State School Nurses Association. So I get to work with her all the time, which is great to see her face again for like the 5th time today. So I don't, neither Dr. Weinberger or myself work for the state, but our chapter does collaborate with the state agencies like the health department, maternal child health department, immunization department, and AOE as well to give recommendations. And so we know what we've recommended and some of the conversations we've had. We're not the ultimate policy makers or decision makers, but wanted to talk about what we've been talking about over the last few weeks and months, really, throughout this school year. So I just do want to take a moment to just reflect on where we've come this pandemic. As an ICU doctor, it was very frightening early in the pandemic when we had this completely novel virus. We had no community immunity. Nobody was vaccinated. No one even had infection-induced immunity. And it was a really, really scary time. And I just want to remember that because we've come a long way since that time. And we have these really great vaccines, like amazing vaccines that are so good at preventing severe disease. They're so good at keeping people out of the hospital. And I think we should really celebrate that and remember that while we're thinking about these case numbers and all the disruption that is happening in our lives, that we're in like a different place, although it is still very, very hard and extremely disruptive, and probably the most disruptive it's really been this entire pandemic, especially for kids and schools and families and pediatricians as well. So I'm going to talk a little bit about the testing. And so let's go back to Delta and think about what we were doing in the fall with Test to Stay. So in Test to Stay, we were saying, so last year, if you were exposed, you had a close contact exposure at school, you had to quarantine. That was true at the beginning of this fall as well. And what we were seeing is we had some data coming out from various parts of the US and from England that really, that meant kids were missing a lot of school and very few were actually turning positive. And so that's why we worked to, in concert with AOE and the health department to work on Test to Stay, which would allow students who are asymptomatic and feeling well, who are not vaccinated, because at that time, although vaccinated people could be infected with Delta, it was much less likely, and we could keep them in school. So this was great, really, had a lot of scientific backing. It was a lot of work. It was very time consuming. It is very time consuming. It's still ongoing. It's extremely time consuming. So, and then we were able to get a lot of 5 to 11-year-olds vaccinated during the fall. So even before Omicron, we were sort of thinking about what is January going to look like? And Omicron has really sort of forced our hand to really shift the way we think about risk and transmission, and really recognize that every family is now in a very unique situation. And so, as you all know, we have this very transmissible virus, super transmissible, and even vaccinated people are getting infected. as many of you know. So does it make sense still to say that we're only going to test unvaccinated people? No, we should be testing vaccinated people as well. Does it make sense to think just about school exposures and not about all the other exposures that are happening outside of the school? So I think about risk of infection after a close contact. I think there's sort of two categories. There's your vaccination status. So people who are unvaccinated are going to be more likely to become infected. Their infectious period is usually a little bit longer, more so than vaccinated people, right? And then there's a other piece, which is really important, which is the type of exposure. And so we know that actually a school-based exposure is the least likely to cause transmission. Then would be a community-based exposure, like someone is gathering with somebody else. And then a household exposure. That's the highest risk, is a household exposure. So we really need to kind of reshift where we are in terms of how we're thinking about making sure that people get the testing that they need based on what exposure they're having, what their vaccination status might be, what else is going on in their household and their home, and what needs and desires they have. And that is all to say that what we are advocating for is for families to have more choice, more flexibility, to be able to test children and their family members in a way that makes sense to them based on all of those things I just mentioned, the type of exposure, vaccination status, et cetera. And we want families to have those tools and those tests and some guidance and be able to do with it what they will. So all of this hinges, of course, on having the availability of tests, which, as you heard Tom say, there aren't a lot of tests right now. So we're in this very awkward holding pattern right now where we know what we need to do is to actually like totally refocus who really needs to be tested. Let families decide if they have a household exposure, they need tests. That's going to be the higher risk setting, not so much the school-based close contact. And so what we recommended from the AAP Vermont is that families should be, regardless of their vaccination status, and staff should have rapid antigen tests. And they, maybe enough for a couple a week where they could do, if they wanted to do some asymptomatic screening, they could do that. If they were a close contact, they could test because they're a close contact. And then with sort of guidance on, again, the type of exposure and, your vaccination status. So all that guidance would come and the family would be able to choose how they would do that. At the school, what we want to do is remember that school nurses are excellent, trained, skilled clinicians, and letting the school nurses kind of go back to that and continue to be able to do diagnostic testing for students and staff. So if somebody was sick at school, that they would have rapid antigens on hand to get a diagnosis and to help give some guidance to go home and what to do next, and maybe with some tests to follow up if the test was negative. So these are our recommendations, along with better access to masking for students and staff, and continued universal masking of everybody, regardless of vaccination status. So that's been a big point for us as well. So that has been our recommendation, and the state has seemed very accepting of that. And let me back up about the contact tracing. And so instead of someone at the school making a painstaking line list and figuring out who is close to who and calling them and letting them know or notifying them that they're a close contact, instead it's going to be a little bit more broad. And I think that makes sense because there is, as we all know, there's Omicron everywhere, and we all go about our day and no one's making line lists and calling us to let us know we're a close contact. And I've just been telling people, just presume that you are a close contact and sort of behave accordingly to that. So these were sort of our recommendations. The problem really is just getting these tests into the hands of families and staff. And I know that probably your question for us right now is where can I get more tests? And that we don't have an answer to. And like Tom said, we don't have any guidance right now tonight to share with you, but I wanted to give you an overview of that's what things are going to look like. And that I do know that there's a lot of focus on the number of cases in schools. How many cases are there? Was my kid a close contact or not? again, I would sort of assume that we all are close contacts, that we've had close contact exposures, and sort of think about doing some planning for your family. So it may be that I know, just because people want to know, what can I do tomorrow? What can I do the next day? Is that for symptomatic testing, it is hard to get in same day appointments at clinical testing sites for PCR. But just sort of thinking like, we're in for a rough 2 to 4 weeks right now. It's going to be rough. There are going to be a lot of cases. There are a lot of cases. Thinking about just maybe scheduling your child, your family for weekly PCR tests. I think we can it's a little bit easier to make appointments further out. So just thinking about that, like, we're essentially going to be close contacts for the next 4 weeks. Like how do I want to manage that? So I think we are happy to help you try to troubleshoot, what to do over the next few days. But the big plan is what I just our suggestion of the big plan. And what I think the state is moving to is what I just mentioned. So instead of knowing a specific contact that you've had, you sort of are assuming you're a close contact, and your family has the ability to test it sort of as you see fit with some guidelines written out. And having the school be less of a, again, knowing that the transmission is less in school than it is elsewhere, that less of a focus on schools and cases in schools, and, having people be, as so many school nurses have said, they have felt like they've had to be kind of COVID enforcers and the COVID police, and that's been really hard. So trying to shift that away, have them do the clinical diagnostic stuff, and then have families do the type of testing that they want to do at home with some guidance. And I'm going to hand it over to Dr. Weinberger.
Hi, sure. Thanks. Thanks for having me. I'm really excited to be here. And I wanted to kind of build on what Becca was talking about with, sort of what to expect. What is COVID looking like? And, I'm a primary care pediatrician. So seeing a lot of kids with COVID symptoms, seeing a lot of kids with COVID. And, it has been, I know it's felt overwhelming with Omicron, and it really has been significant. In general, the way that kids are presenting or showing up with COVID really is across the spectrum, but it's not totally different than how kids used to present. It can range anything from having no symptoms and just being a carrier of COVID to mild symptoms, mild runny nose, sore throat, cough, to more kind of whole body symptoms of achiness and fever and headache, to more of those respiratory symptoms, coughing. We have seen more, I would say anecdotally, I've seen more vomiting in kids with this, but it can be the whole spectrum, and it can be incredibly mild. I know I talked to lots of families where there are just a few symptoms, and whenever there's any symptoms, it's important to test. This can show up as just a runny nose. We've been hearing a lot in the news about more kids being hospitalized, and, right, that has us all concerned. I think a couple things I would just note with that, we're used to seeing a lot of significant respiratory disease, particularly in the winter. Every year influenza comes along and a number of kids are hospitalized due to that. Every year RSV comes along and a number of kids are hospitalized due to that. And with COVID, generally we've been seeing less of that really significant lower lung respiratory disease. And so, yes, kids are being hospitalized, but in part that's because there is so much Omicron along. But it is, in general, kids are doing really well. With the really young kids, with some of that vomiting and coughing, some of it is just difficulties keeping hydrated. In Vermont's a little bit different too. We have not been seeing kids hospitalized like you're reading about in the national news. That's really good. I think it's important to just remember that, our local context is a little bit different. And we have a really high vaccination rate. Another important thing to just sort of point out, right, with Omicron is it is so contagious, and it makes you, if you're going to get sick, you catch it pretty rapidly. So, from the time where you're exposed to someone with COVID to the time when you get sick with it might be just a couple days. So it's quite rapid, and it's just, as Becca Bell was saying, it sort of changes kind of how we have to handle that. I think it's just also really important to remember that, we are a long way from where we had been. And we have, although, COVID keeps surprising us, and certainly, this is incredibly disruptive. We know a lot more about what can keep us safe. I would totally reiterate the vaccines. It has been an incredibly effective vaccine, particularly at keeping you from getting severely ill. It provides protection against getting COVID, even Omicron, but there are breakthrough cases, but it really provides excellent protection against getting sick. It's also true, we've learned that over time, your protection from the vaccine starts to wane. And that's true of most vaccines. Really all the childhood vaccines we have require a booster in some form or another. So this is not totally unusual, but it does wane. And so it's good to point out that, if you're eligible for a booster, we totally recommend it. That provides a big boost in protection. And all kids 12 years old and up are eligible to get a booster 5 months after their second dose. So just, that means that if you were vaccinated and you had your second dose in early August 13th, you could get your booster. And so look for those clinics, contact your pediatrician's offices. The majority of pediatrician's offices are doing vaccines too. Our goal is to just make it as accessible to people as we can. Masks matter. I'm just so impressed at how the kids in school have done with masking, and how all the adults surrounding them have modeled that, right? That makes a big difference. It seems that high quality masks, wearing the masks correctly, all those things just sort of increase your level of protection. And then staying home when you're sick. There are folks who carry Omicron and have no symptoms, but the kids who are sick are probably the ones that are most contagious. And if you're sick, stay home. There's a lot of other stuff around, and it is incredibly frustrating, right? It could be Omicron, it could just be a cold, but it's important to stay home if you're sick. The other thing I would say is, you've got a lot of support at the school. Remember, things are busy in the doctor's office, but this is what we're here for. We're here to answer questions, to talk about your child's personal medical history, your situation, to help problem solve, figure out what's the next best step. So don't hesitate to reach out. I am taking the liberty of speaking for all my colleagues here, all the local pediatricians, but that's what we're here for. Why don't I stop there, and we can just kind of, take questions or things that have come up from that.
Thank you very much, Becca and Stanley, for sharing your perspective and your sort of wishes and your advice as we go through these next few weeks. Becca, you had mentioned a little bit just about like your recommendations are, to test everybody, not just to test the unvaccinated contacts. And we've heard from our community a lot, and our community has questions. So Tom, I'm wondering if you can share some insight into your thoughts on that. And then Becca, we have a related question, which is, there's a question in the chat that I certainly don't know the answer to well enough, but maybe you or Stanley do, is can we talk about the reliability of rapid tests, and specifically how reliable are negative results? So, but I'd like to hear from Tom first to talk to the community.
Yeah, and I see just an update on tests, because I also see another. We have questions in two places. You can type them in the chat, and we will see them there. And we also asked on a form for you to submit questions beforehand, so we'll be looking at both of those. But vaccinations, testing is coming up as a pattern, obviously, of questions. So first, I want to say that we are shifting. The types of tests that we're receiving are changing. So we were receiving antigen tests in big boxes that we could use for test to stay. Those boxes had the Q-tip, that you can put on your nose and test, and it had one bottle of the fluid you needed. So those were the kinds of tests that we were receiving. There were a bunch of tests in each bundle, but only a little bottle of fluid, so that we couldn't give those tests out. Those are what our school nurses were using during test to stay. As the state started to think about a new testing strategy where we will be giving tests to families to take home, they shifted the kind of test that they're sending to us. So what happened this week is we started almost running out of the tests that we were using for test to stay, while we hadn't received yet the shipment of the new tests. And we were having a lot of cases and a lot of close contacts. So we have had a lot of cases this week, and what that creates is a huge number of close contacts. And so that's where our testing supply has been really stressed this week. But thankfully, we ordered 5,000 tests. We have those here. We asked the agency to give us any tests they could. They've delivered a number of boxes of those old test to stay tests. So we have those. So we're able to keep running. And what we learned today from the Agency of Education is that they are anticipating a large shipment this weekend that will be ready for the beginning of next week. So we're in a good place now for testing. Those tests are designed for us to give to unvaccinated students who are close contacts. But we do want to be able to give tests out to vaccinated close contacts, and to have them in the nurse's office to be able to use for students who may be showing symptoms at schools. So that's our goal. What we don't know yet is the testing supply that we're going to get. So that's where we're still waiting to see next week how many tests we end up with. And we, like I said, we are also using our American Recovery Rescue Plan funding that we received from the federal government to purchase additional tests. So this testing strategy is going to be a big one for us, continue to be a big strategy for us. But this week was a really challenging week with all the factors of switching from one testing practice to another testing practice, and in the middle of a surge. So yeah, I wanted to share that with the group. And then Russ, were you calling on Dr. Bell or Becca McCrae?
Yeah, I think Dr. Bell, actually, I'm going to give you a two-parter, or Dr. Weinberger. Couple of questions that I think maybe fit well together. One is around the reliability of rapid tests. And then we have a couple of people in a couple of different places just asking if we have any advice for those of us. I'm sorry, I overshared during our preparatory meeting this afternoon, but those of us who have pre-K students as well who can't be vaccinated, if you have advice for those families. I think, Becca, you touched on it a little bit in what you were trying to talk about, but I think that would be helpful for our families too.
I can do the rapid antigen. So it's pretty good. And I think, I was actually just in another meeting where there was an infectious disease doctor talking about a study he had done with comparing PCR and rapid antigen, and it's pretty good. I think the important thing to know about it is that it really is, can tell us when we're most infectious. So I think what it can't really do is if you test early, say like early after an exposure, and you're negative, it may not, you may be positive in a couple of days. But what we're really trying to do right now is say, how do we identify when people are at their most infectious period, let them know right away so that they can stay home. So rapid antigen tests do a pretty good job of that, of identifying, hey, you're positive, stay home. Let's keep you home, isolate you during your most infectious period, understanding that there's some risk on either side, where you might still be infectious, like not your peak infectious time, but you may be infectious. And that's why masks can help with that too. The other key thing, and Dr. Weinberger touched on this, is if you have symptoms, stay home. And so that, I think that sometimes gets missed when we're talking about the testing and the days and da-da-da. So if you have symptoms and you test once with a rapid antigen, you really want to test again the next day. I wouldn't say like just one time. One test says for sure that you don't have COVID. 24 hours apart is pretty good. So sequential tests with rapid antigen is really helpful. PCRs are excellent, really excellent tests. And so I encourage people to do PCR testing, especially, if you can, if you've got symptoms, a PCR test is really good. So if you wake up on Monday, you have symptoms, you can get in and get a PCR test, and you find out in a day or two that it's negative. Like that's a really good test, and that's really helpful. It's just we were at a point where it's been hard to get like same day appointments, but that's why maybe scheduling some PCR tests like once a week, if in your family that makes sense to you, knowing like you're going to be a close contact every week. That's kind of like maybe your 5-day check after a close contact. That's excellent test. So for the rapid antigen, it does pick up when you're most infectious. If you've got symptoms, you got to do more than one. If you've got symptoms, you should stay home. Also, there's a lot of other viruses going around. As Dr. Weinberger mentioned, there's some RSV and there's rhinovirus and other things too. And so for that reason, we also want people to stay home. Like, I think I don't want people to go like, oh, it's not COVID. Great. I can right. There's other stuff. And those other things actually make especially the infants and medically vulnerable children in our community really sick, like RSV. So we just want to keep that in mind too. And speaking of RSV, I'll hand it over to Dr. Weinberger for the younger kids advice.
Yeah, thanks. That's great advice on testing. And, I guess the only other thing I would add is, right, no test is perfect and they're pretty good, but it, how you interpret the test depends a little bit on how likely it is that you have COVID. And so right now, in where there's a lot of Omicron in our community, and particularly if you have symptoms, that if you have a positive rapid antigen test, that is positive. We do not recommend retesting. You just treat that as positive. Now, on the flip side, if there's Omicron all around and you have symptoms and you happen to get a negative COVID antigen test, chances are that could be a false negative test. And so, when folks call our office, that's where we say, great, let's get you in. Let's do that PCR test. We will find it. But if you had a positive antigen test, we would not recommend repeating it. And that's just a little bit about how we interpret the test based on what's going on in the community and what's happening with your child. In terms of young kids, right, it is really challenging, right? For a couple of reasons. One, the younger you are, the harder it is to wear masks, right? And so, particularly those kids under 2, I'm always impressed at the kids in the 2 to 3 age range who can wear masks well and have learned that over time. But, you can't do that. Also, your testing strategies are a bit more limited, right? The rapid antigen tests are not approved for under 2. And what that just means is we just don't know how much you can trust the result. And so that's really challenging, and also young kids are obviously they get sick a lot because they're just less reliable hand washers and touching their faces, and they're around other kids who pick up infections frequently. I think importantly, while we hope that there will be a vaccine for younger kids coming in the future, it's also important to remember that, as compared to some of the other things that affect young kids like influenza and RSV, COVID thus far, Omicron has tended, while more severe in the real young kids than your average elementary school or middle school kid, still tends to hospitalize less kids than, really severely than RSV. And so I think, we do the best we can. And, vaccinate the people around them, right? One of the ways that we protect people who can't be vaccinated, or, we keep vulnerable people safe is by, those of us in their cocoon or bubble, just trying to, be as safe as we can so that we're keeping them safe. That being said, for young kids, just like our school age kids, right? Those settings, childcare settings, preschool settings are important. Just like school, it's important for kids to have those. It may be necessary for kids to have those. And, Vermont has done an excellent job at making those places as safe as they can be. I mean, the record here is they've done a great job. I don't know if you would have anything to add, Becca.
Yeah, I mean, I think that everything is local, and so it is. The national headlines are never, I mean, they're never reflective of the nation, right? Even within Vermont, we see widely disparate vaccination rates. And Burlington has really, really good vaccination rates. And so, and Vermont as a whole really has really great vaccination rates as well, the highest in the country. So our experiences in the hospital are very different from my colleagues who work in lower vaccination areas across the country, just totally different. And so, yeah, we're always happy to sort of talk about what we're seeing. And I think, I guess two things. One is there's a lot of feelings and emotions when a lot of us are getting COVID right now. And there's a lot of shame and guilt and despair about it. But that's when I want to go back to March of 2020 and say, people are vaccinated, people are getting infected, but infection is not the same thing as disease. And it's not a moral failing. It's not anybody's fault. We're all doing the best we can. And I think we need to give ourselves a break around that. I've just had so many people upset about this. And then the second piece, I'm already forgetting what I was going to say. The second piece is my child is tested positive for COVID. What do I need to look for? What are the things? And it's the same. It's the same as anything else. It's nothing different. So if you have, Dr. Weinberger mentioned this, but if there's any concerns about breathing, whether it's an upper airway or lower airway stuff, we haven't seen lower airway stuff in younger kids, just in the unvaccinated adolescents. Same as if it was RSV or rhinovirus or metapneumovirus, if you're worried about the breathing, you're gonna give your child's health provider a call. And for infants, likewise, if they're just not feeding well, fewer wet diapers, all the same stuff. COVID really looks like a lot of other viral illnesses. So there's nothing that's specific that you need to look for or worry about beyond what you normally do for your child. So that's just another piece of advice as well.
Thank you, Dr. Bell. Becca McCrae, I am seeing some questions in here about what unvaccinated means, what fully vaccinated means, and then also about who needs the test, or who need, I have a family member who has COVID and the student is vaccinated and testing. Can the student still attend school? So I'm wondering if you can share just quickly, if you would do, what does vaccinated mean? Who has to stay home? Who can come to school? What that close context means? And then I'll ask you a follow-up question after that. But if we could answer those quickly, I think that'd be helpful for people.
Sure. So I did answer a couple in the chat. So the definition of fully vaccinated is that you have had 2 doses of the vaccine and 14 days have passed since that last dose date. That is the definition of fully vaccinated. At this time, the science has shown us that if you have had your shot more than 5 months ago and you're eligible for a booster, that your vaccination is not as effective after that time period, and a booster is going to create it to be as effective as when you first were fully vaccinated. So the definition of fully vaccinated hasn't changed with the introduction of booster. It's just that the booster is making your vaccination more effective over time. So you're not going to be, when you're 100% effective is when you have both doses and are fully vaccinated, and then over time receive that booster in that 6-month period. So that's the definition of that. In terms of who can come to school and who can't come to school, it's been really confusing, I know, from the beginning of this calendar year with the introduction of the new CDC guidance, which has literally constantly changed day to day on their website, and currently is still being altered for all of us medical professionals, whether we're in the school or the hospital. It's been quite hard to navigate and to also educate families as it has changed so frequently. But at the current moment of this recording that we are currently live in, it states that if you have a 5 to 17-year-old who is a close contact, they are allowed to come to school if they have 2 boosters. It does not matter how long ago those boosters were. I mean, not boosters, sorry, I'm saying the wrong words. If they have 2 doses of the Pfizer vaccine, it does not matter how long it has been or if they have a booster, they are considered the same as a fully vaccinated person with the booster, and they may come to school. They're recommended to test at day 5 as long as they're asymptomatic. If you're symptomatic, we're still following the same guidelines that we have been following, which is if you're symptomatic, stay home. You can test with a rapid if you'd like, just for your own knowledge, but you're staying home and you're observing those symptoms for the 24-hour period. If they don't go away in 24 hours, or if more symptoms develop in that 24 hours, you're to go get a PCR test so that you can be diagnosed if it's COVID or if it's something else, or you can call your primary care provider and talk to them about what your symptoms are, and they can guide you in the next steps. But it's really important, and I know both Dr. Bell and Dr. Weinberger have said, if you have symptoms, it's important to stay home, whether it's COVID or not, to protect the people in our buildings who are susceptible to disease. I forget the second question that you asked me.
No, I think that's good. We do have some questions here, Becca. I'm wondering if you are able to shine a little bit. There's a couple of questions like what are schools doing during lunches and snack time when those students are unmasked? And I wonder if you could share a little bit about that, and then if you have any sort of suggestions for parents to talk about with their students as well, that might be helpful.
Sure. So I think that in the beginning of this disease, when we started, we had a lot of things that we put into place that like the plexiglass that we thought was going to help protect us. And then over time, we found that it doesn't protect us. What protects us is distance and the time that we're with someone in that distance. Doesn't matter whether you're masked or unmasked. When we are talking about who's a close contact and the susceptibility of this disease, it's distance and time that makes you a close contact. So when we look at the guidance of 3 feet away, so all of our lunchrooms, the kids sit 3 feet from each other. And so they're sitting there and they're eating. And I was in a meeting earlier today where we talked about this, and kids have to eat. Like there's a lot of a lot of people don't agree that we should be using the cafeterias, but we need a place for them to eat, and we need to give teachers a break and have them supervised. So there's a lot of details that go into that. But in terms of safety, they are 3 feet apart as what the guidance is. I'm not sure if Becca or Stan, if you have anything from the American Academy of Pediatrics in terms of that, or just in general as providers, but that could, quell the fears of cafeteria use.
Yeah, I mean, I think this has always been a question even before Omicron, because this is the high risk. It's the inside, masks off, eating and talking, and a lot of people in the same place. And so it's been, it's the highest risk time of the day in terms of transmission. And it's just, like you said, Becca, people have to eat. And so we've always sort of accepted that as a high risk time. There was a question, and this was posed to national AEP recently, about, when the CDC says you can shorten isolation, for instance, if you're feeling well. Again, the feeling well part is really important. You can shorten isolation, and then you need to mask. And so the question was, well, if kids take their masks off, does that mean they can't come to school? And really the AEP is saying, no, they can come, they can go to school. We know that masks are going to come off. And it's just trying to have people in school, and knowing that there is going to be a little bit of risk there. And I think in some cases, people have come up with some creative ways. But at the same time, I think that it's just the high risk time of day. I don't know. And we've sort of accepted that, basically.
I guess I would add just maybe 2 things. I will tell you, being in a primary care practice where, all of our staff and nurses have to eat, and it is also the high risk time for us. And we try to space out as best we can, but it is challenging in our workplace as well. The other thing I guess I would just say is all of these protections, we sort of work on layers of protection, right? So that no one layer is foolproof, but if you have a number of different layers, they help. And so I was thinking of, right, the child who goes back after day 5, but is wearing a mask after having COVID, is feeling much better, is wearing a mask. That's not perfect, but it gets that kid back in school, and that child is going to be much less likely, if at all, to spread COVID compared to how they were at the very beginning, when they were just about to get sick. I'm thinking too of the question around, N95s and effective masks. I'm remembering back to the beginning when we had the, single layer neck gaiters. And then, we just learned that, right, more layers is better. More, the more barriers you can put up, the better protection. And that does make a difference with Omicron, right? When you have something that is really contagious, that means, we're breathing in virus. And whereas you might have to breathe in many more virus particles to get sick previously, now it takes a lot less. Omicron is just more contagious. And so, but again, it's one layer of protection. So I think if folks are able to get the paper surgical masks or the KN95s, that's great. I really applaud the school for trying to get those and distribute them, because they're hard. It will not be perfect. And as a parent of a young child, I know that my daughter's mask gets wet. And so we try and send a lot along, but we're going for as good as we can get.
Yeah,
it is true that N95s, so for example, if you are taking care of a COVID patient like Dr. Bell does in the ICU, right, you need a fit tested N95. that's not practical. I don't wear that to the grocery store. That is frankly hard to wear for any amount of time. But yes, that would be the standard you would wear in that setting. And that's impossible in a school setting.
Yeah, and I just wanted to add that it is one of the things that's really hard to sort of wrap our heads around and talk about, but the harm of not having students together, not being in a community, a learning community, and how does that harm, and sort of what's the risk of that compared to the risk of eating lunch together, right? Of lunch and the transmission of COVID, right? And so we are being mindful of spacing, being mindful of numbers in the cafeteria, being mindful of noise, right? And yelling, and sort of making sure that we're trying to keep them as calm as possible at lunch. And we've seen this year the really serious impact of not being in school on students' mental health and well-being. And you hear, although I did run into a student today who is not loving school, almost every student I talk to says that they want to be in school, right? What they want is to be in school with their friends. And I know that, that we have to do this very carefully and be very mindful of how we are as safe as possible. And there's inherent risk in some parts of the way that we are going to have to operate.
I would also just add that because we can track numbers and cases somewhat, there's a lot of focus on that, but a reminder that this Omicron surge here happened when schools were not open, and the Delta surge that overflowed hospitals in the South happened in the South before their schools were open. And so again, a reminder that we get, and we all do this, we get nervous about some settings, and in more familiar or comfortable settings where we kind of let our guard down. And back in the day when we could actually contact trace cases, because there weren't that many of them, we did know with prior variants that really it was these familiar gatherings that were happening that were informal, masks up, people eating and drinking it over, in a gathering setting, and not so much the school setting. So I think that piece is important too, is all the stuff that everyone's doing outside of the school. The school is a reflection of what's happening in the community. And we know, if anything, the school tends to have less transmission than the community.
Thanks, Becca. I think a follow-up question that is sort of related as we talk about, some of these pieces is there's some questions about how cases are being it's not traditional contact tracing as it has been, as because there's so many cases that you just pointed out. But Becca McCrae, could you talk a little bit about how we're going forward, what our and just reminding people that this guidance is still brand new to the district. I want to remind people of that. I think we've worked really, really hard to do really diligent contact tracing over the past year and however long we have been in this. I'm sorry. And that guidance is shifting. And this week was really our first sort of foray into what does this mean for us? How are we going to do this? So I also want to acknowledge that we made some mistakes on our end in the past few days. I know that we didn't get notifications out to sort of all of our community that we've been doing throughout the rest of this pandemic. And we reached out to people who actually did have vaccination statuses. They were fully vaccinated, and we said, you're not vaccinated, come test to stay. So we're making some mistakes now, but we're working really hard to fix them quickly and to learn from our mistakes. So I do want to ask for some patience from the community, if I may, and let you know, we care and we're trying really hard. But Becca, could you talk a little bit about what our plans for at the high school and at the middle school, when the middle school might be changing classes as well?
Sure. So first, I just want to set the scene that in the first 2 or 3 months of school, we contact traced 30 cases. And this past week, we have been doing 30 cases a day. So that is what we're dealing with. And the high volume has really impacted our thoroughness. And again, apologies that we have had some mistakes in the past few days. And apologies that if you were contacted and your student's vaccinated, or you were contacted and your student wasn't there that day. It's been really hard to try to get everybody contact traced in the same day and get messaging out to all of you. So we're doing our best. What I learned today in a meeting with Dr. French is that when the new guidance comes out, and again, it is not out yet in written form. So we're really trying our best to like navigate these waters without written anything yet. But we learned today in a meeting with Dr. French that moving forward, we're going to be having a daily message out to parents that would say a very general, today we had cases in these classes. And so at the elementary level, what that looks like is, because we're having multiple cases in every school, like almost on a daily basis. So what that would look like in an elementary school setting is, today in our school, we had cases in the kindergarten classroom and the 5th grade classroom. If you feel you were a close contact, you may. And then this is the part where the guidance isn't out yet, so we're not sure what it's written, but we understand that there will be a guidance for vaccinated close contacts, and there will be a guidance for unvaccinated close contacts. And there will be some sort of testing availability for anyone who thinks they are a close contact in that case. In the high school setting, it would look similar in that we would put out where the close contacts were, but instead of saying 5th grade or kindergarten, it would say in Spanish 10 or in Algebra 2, or sorry, I don't know high school classes, but it would be something similar to that, where it would list all the classes where the cases would be. Again, I just want to put out to you that if you are a vaccinated person with no symptoms, you are still allowed to come to school, and you are recommended to test at day 5. So my anticipation in all of this, from what I understand, is that vaccinated people will have access to tests, but an unvaccinated person will probably receive more tests, just because they would have to quarantine at home for 5 days. And so they would need to be testing those 5 days to come to school, whereas a vaccinated person is recommended to test at day 5. So they would probably be receiving less tests. So I just want to lay that groundwork. And again, the guidance isn't out and written yet, but that's where we're headed because of the sheer volume of cases.
Thank you, Becca. I think we probably we're over time here, and I want to respect your time, Dr. Weinberger and Dr. Bell. If we might have one more question, we talked a little bit about it in our pre-meeting today, and or maybe, I'm sorry, this one might be from my own pediatrician, so I actually might be putting you on the spot here. But we have a couple of questions in the Q&A that we submitted, just people sort of worried about long haul in the Omicron. And so I'm just wondering if you wanted to talk a little bit about that, and a little bit about, we talked a little bit about this version of the virus. But I think we'll let that one be our last question. I do want to acknowledge that there are a couple of questions in the Q&A that are really, or in the questions that were submitted to us, that are really about like state level policies. And so I don't feel comfortable sort of saying, weighing in on what some of the questions in here are sort of suggesting about the state policies and who they serve and who they don't serve. But I just want to remind, our community that, our goal is to always be inclusive. Our goal is to communicate. Our goal is to be transparent. Our goal is to keep all students safe, regardless of, gender, race, sex, language, ability. So we are prioritizing student health in the district, and we'll continue to do so. So, and as far as, athletics and return to play athletics, that being a consistent thing across the state, I think that's something we're going to have to continue to look to the state for that guidance, and work with our athletic director certainly to get the current information to families and coaches as soon as possible so that we know that sports and extracurricular activities are important for students, and we want kids to have access to that. So we will continue to try as hard as we can to get that communication out to families. So Dr. Bell or Dr. Weinberger, whoever wants to take a crack at it, I think the last couple of questions we have in here are like, you have thoughts about long haul for this variation and especially for kids in general?
So we definitely don't have any info on Omicron, right? It's like too soon. But so long haul or long COVID or persistent symptoms after COVID infection is a known entity. Trying to understand exactly how often it happens and what it looks like and what the definition is like an ongoing discussion. What I can say generally is that it definitely occurs at a lower frequency among kids than among adults. And then the studies you really want to look at are really when they compare control group. So kids who've had COVID, kids who haven't had COVID, and you're checking in with them to see what kind of symptoms they are. Like those are the studies you want to look at, not just the studies that just ask people, because the percentages kind of differ wildly. But people can have persistent fatigue. That's kind of the most common complaint around persistent symptoms. The other thing is it, are we saying 3 months, 4 months, 6 months, 12 months in terms of persistent symptoms? And all of that really matters to families. And I guess I don't have the answer to that. And I don't know, Stan, if you've seen some of that in your clinic. I know we have an adult, a clinic or some specialists here on the adult side who see adult patients with long COVID, and they've given us some presentations, but I'm not sure, since it's more of an outpatient thing, what folks are seeing on the ground.
Yeah, I think, thus far there is just not that much known about long COVID in general, but in particular in children. There are many more studies in adults. And so there's not a lot there yet. I mean, anecdotally, but again, Vermont I have not seen kids with a lot of long-term symptoms, but again, we have not had the vast numbers of COVID as some other places in the country. So that's not to say that it doesn't exist. It hasn't, I haven't seen a lot of it in my office yet, but I'm sure that it does. It does seem that kids have a lower, as best we can tell from the early data, that it's less common in kids, but just how it looks in kids and how is it different than adults, and really how frequent is it? Yeah, we don't know yet, unfortunately.
I do want to add one quick thing, and that is on our website, aapvt.org. We have a bunch of virtual town halls that we did this November and December. Dr. Weinberger did one of a bunch of different pediatricians talking about the vaccine and answering people's questions. And I think people have said they've been really helpful, and all those recordings are there. So if you want to watch it for yourself, if you want to send it to a friend. But we really want to keep talking about vaccination. And I think, again, people feel vaccinated, people who are getting infected and testing positive and having some symptoms, many are feeling really down about that. But the vaccines were really to prevent severe disease, and they're doing a really, really awesome job. We're seeing that in the hospital. We are not taking care of vaccinated patients who are sick with COVID. So just remember the vaccines and have some trust in the vaccines.
Thank you very much. And I think that's all for now. I am going to drop the link to the vaccination in a answer here for folks. But I just want to thank everyone again for making the time to join us today. I really appreciate you being here. If you feel like your questions were not answered, please send an email to superintendent@bsdvt.org. As Superintendent Flanagan noted at the beginning of this, staffing is stretched thin. We will try to get answers to those questions as soon as possible. and we'll and for if we're seeing like a lot of the same question, we'll consider those for community updates or other ways to answer those questions so that we can get this information out to as many people as possible. So Tom,
Russ, yeah, thank you. Thanks for emceeing. Dr. Weinberger, Dr. Bell, thank you so much for being here. And Becca, thank you as well. You know, as a parent of 3 kids who are in the schools, you know, I know we're all feeling anxious. I also, we are working really hard to make sure that our schools are as safe as they can possibly be. I feel comfortable sending my own kids to school every day in our schools. We've done a really good job throughout the course of this pandemic to do everything we can to keep safe. We know that vaccines make a difference. We have slots open for vaccines tomorrow. It's really important that we get as many people into those slots as possible. And we'll open more vaccine clinics over the course of the next couple months. So we'll keep with the vaccines. We're going to keep focusing on masking. Again, we've ordered additional KN95 masks. We're going to be bringing those online and soon. And lots of tests have come in, and testing will continue to be a strategy. We're going to really work as hard as we can to figure out how testing is also a strategy for our vaccinated students. And we're going to be adjusting and communicating as we get the new guidance. But even though we're stretched, even though the guidance has been shifting, the teams on the ground are doing amazing work and doing really the type of work that I feel proud of, and the type of work that I feel really comfortable and confident sending my own children into our schools to learn every day. And so thank you all for sticking with us, for giving us your feedback, for asking us your questions, and for being part of this community together as we work through this. And with that, have a good evening.
Thank you, everybody.